Hi, my name is Jessica, and I'm going to be talking about getting a patient ready before entering for surgery. So, I would knock on the door, enter the room, introduce myself to the patient, perform hand hygiene, put on gloves, and identify my patient with two identifiers. I would check their vital signs and record those in their chart. I would see if my patient had any advance directives like a living will or a power of attorney. And I would make sure that the pre-admission assessment was complete. I would help my patient into a gown, a hospital gown, remove any kind of jewelry, makeup, hair clips, hairpins, anything that might fall off during surgery. Make sure the patient is fully in just a hospital gown. I would make sure that the valuables and belongings are sent with the caregiver. Make sure that my patient understands the procedure they're getting and the reasoning for it, and also make sure that the caregiver understands that. I'll make sure that my patient hasn't eaten or drank after their restricted time per their order. I would make sure the patient has taken the following medications that the prescriber had ordered, and make sure that if any bowel preparation was needed, that was complete. I would double check the patient's med history and their disease process history, make sure that that's fully recorded in their chart. I would make sure that the lab work that was needed was complete and that all consents are in their chart. I would have my patient use the bathroom and insert an IV, and then any medications or fluids that were ordered, I would make sure those are started. I would put TED hose or compression stockings on my patient just to help prevent any blood clots. If a catheter was needed to be inserted, I would perform hand hygiene and insert the Foley appropriately. I would have my patient wear their dentures or their glasses or hearing aids as long as they needed to, and then before they go back, I would make sure those were removed and placed with the caregiver or family member. I would clean the surgical site with the proper solution, whatever is ordered. And I would see if my patient had any questions and make sure I answer them, or if they have any anxiety or anything like that about the surgery, I would help them cope with that. Make sure they understand the expected outcome of the surgery before entering, and make sure that the caregiver understands that as well. I would make sure that we have a list in their medical record of all the valuables and belongings that were with them that we gave to the caregiver to hold while they were in surgery, and make sure that my patient is still MPO and make sure everything is documented. Then I would make sure the bed was in the lowest position, upper half of side rails are up, call light is within the reach, and make sure my patient knows I'm there for them if I need anything and to just call me.